I'll make a start. Good morning, and thank you for attending this session. It's going to be in English, I'm afraid. My name is Madhukar Bose. Please call me Maddie if you're worried about pronouncing it correctly. I'm going to talk about what makes a world-class digital health ecosystem from a growth of innovation perspective. I work for the British Department for Business and Trade. We are the part of the British government that is responsible for supporting British businesses and international businesses to find a better home in the UK. So a lot of my work is around exports and investment for digital health specifically. But the work that we do as part of the department's Science and Technology Directorate is very much about supporting the vision from the highest levels of government to make the UK a 21st century science and technology superpower, building on the great research and scientific heritage that the UK has. So today I'm going to talk about digital health ecosystems from 8 perspectives. Sorry, 9 I should say, perspectives. And these are different dimensions that you need to get right. I'm going to talk about each of them and also what the UK is doing for each dimension. So the first one, and we heard this in one of the earlier panels, innovation hubs. There are 3 critical ingredients that need to come together to generate digital health. The first is clinical, then you've got technological and research. These 3 ingredients, if they come together, then you create strong innovation that is aligned to the needs of the healthcare system. In the UK, you have something called the AHSN network, which is created specifically for this purpose. There are 15 networks across the country, and their job is to bring together those 3 ingredients. They run things like, if you look at some of the logos there, the HIL, which is the Oxford-based digital health accelerator, Propel, which is based out of Leeds. They are all specifically looking at how to generate better digital health. You have London-based networks, again, as part of this AHSN network. There is a growth pathway question. Now, one of the challenges in the UK has been, how do you enable technology to grow better? Even where you have good technology, even where it solves real needs, there is always a problem of scaling up across the system. And the way that the UK is addressing those is, on one hand, in England and Scotland, you have defined very clear pathways for a solution as it goes from idea to prototype to diffusion and to scale up. That there's a very clear map that says when you are in these stages, what sort of support do you need? Where do you need to go? If you say you want to generate evidence for your solution, where do you need to go? Then there is funding. So for funding, there are in the UK, it attracts the highest level of health tech funding from a VC perspective across Europe. But there are also programs that the government runs to support development and growth of technologies like AI. Central infrastructure, and again, this is something we heard earlier. If you want to create a digitized national ecosystem, you need central infrastructure that works. In the UK, you have something called a spine, where you have health records, you have electronic referrals, prescriptions, and a whole set of other things. Aligned interests. This is where you want to make sure that the system is incentivized to consume digital health, that it works for patients and providers, and of course the state as the insurance and the payer of these services. If you don't align all of these, then the digital health innovation ecosystem will not grow. Data. Now, I spoke about the 3 ingredients of research, technology, and clinical, but the one ingredient they all need to generate innovation these days, especially when you look at data-driven technologies, is access to high-quality healthcare data. Now, in the UK, you do this through, there's the Health Data Research UK, who runs 9 different hubs. Some of those are based on specific disease areas like cancer or bowel disease or eye disease, where if you want to generate or develop some innovation, you can go and access data through that route. You have 5 centers of AI excellence, 3 on imaging and 2 on digital pathology. and the biobank. I know that there's a biobank in this country as well, but the UK biobank is a key data source for innovation. Workforce, we all know that there are workforce issues that all health systems are facing today. There have been a concerted effort on the UK government's part to understand how to better equip the clinical workforce to use technology. There are two reviews carried out, one that talked about the workforce, clinical workforce better using the technology of the future, and the other that talked about the clinical leadership that is required in technology, and came up with the new idea of a chief clinical information officer for NHS organizations. Trust, now this is, I won't explain this too much, but the idea is that if you want to run a successful nationalized digital healthcare ecosystem, then getting the trust of clinicians and patients is very important. Regulation and policy. This is the last one. This is about balancing, on one hand, the need to make sure that the technology that is out there, that is being used by patients and clinicians is safe. But on the other hand, you also want to make it quick and easy for innovations to be regulated so that it doesn't slow things down too much. And that is the balance that you need to strike. In the UK, there are 4 organizations have come together, the names are on there, to create a unified single agency solution for, especially for emerging technologies like AI, because regulating AI is a challenge in itself, which all regulators are at the moment trying to work out. I have very little time left. I'm just going to say that when we talk about promoting the British expertise overseas, we have created something called the UK's Digital Health Playbook. Please do access it through the QR code if you're interested. It is our way of articulating what the UK has to offer in response to some of the major healthcare challenges that you're facing today. None of these challenges will come as a surprise to people in the audience, I'm sure. But it is about how we can support economies across the world in resolving or answering the challenges that you face. I won't go into those in detail because we don't have time right now. But I'll close on this note and thank you for your listening.
Thank you.